Hello class, my name is Candice Birthright and today I'll be discussing nursing home residents with pressure ulcers. During this presentation, I will define the issue and give a brief background. I will also indicate whether the issue has shown improvement or deteriorated over the years, what has been done to improve this issue, what has not worked, how is quality measured for this issue, and what quality indicators are used to measure the outcomes. I will also discuss how health policy can be used to improve this healthcare problem. Should it be local or national policy or both? And lastly, I will discuss what exactly I'm requesting from the Congressional Committee in order to improve pressure ulcer rates in nursing home residents. The United States National Library of Medicine defines bed sores as areas of damaged skin caused by staying in one position for too long. Also called pressure ulcers or decubitus ulcers, bed sores most often develop on skin that covers bony areas of the body such as the heel, ankles, hips, and also the tailbone. Bed sores fall into one of the several stages based on their physical characteristics, their depth, and also the severity of the ulcer. People most at risk for bed sores are unable to turn and position independently, meaning they're confined to a bed or a chair. Those with chronic diseases such as diabetes or peripheral vascular disease, which we all know causes poor circulation, and also those confined to long-term care facilities such as nursing homes. Now let's discuss if this issue has shown improvement or has it deteriorated. According to Estes, rates of pressure sores among short-stay nursing home residents fell from 19% to 14% between the years of 2004 to 2008, with a similar decline among long-term stay residents. These results indicate the issue has improved over time. Another indicator of improvement is patients who gained improved mobility grew from 37% to 47% from the years 2004 to 2009. What has been done to improve this issue of pressure ulcers? Long-term care facilities have been widely scrutinized for the care of their residents, resulting in multiple lawsuits. Nursing homes developed skin breakdown monitoring tools, as we know, the Braden scale, which is the most popular, along with various policies and procedures to help decrease the incidence of pressure ulcers among the elderly. Public reporting is also cited in our text and collaborative efforts from the National Advancing Excellence in America's Nursing Home campaign as other reasons why improvement have taken place. So, apart from the Braden scale that is basically enacted nationwide, a campaign organized by nursing homes and the federal government is in conjunction with the federal government has improved the rates of pressure ulcers in the elderly and also male females confined to the bed. Now let's discuss what has not worked. Though there has been some improvement over time regarding the incidence of pressure ulcers, the United States continues to trail other advanced countries when it comes to quality health care. The federal government allocates funding, however, more is required. Fundamental to a high performing healthcare system is having ample capacity to innovate and improve. Unless facilities comply with the policies that they themselves enact and hold their staff accountable for providing better care, nursing home residents will continue to have higher rates and incidence of pressure ulcers. Next, we will discuss how quality is measured for this issue and indicators that are used to measure the outcomes. Quality care is measured by assessing how many nursing home residents have reported pressure ulcers. The average rates versus the benchmark rates are utilized as indicators to measure outcomes. The average ratio of the United States versus the benchmark rates provided by the federal government is currently 68% according to our text. Both local and national policies need to be enacted in order to not only prevent this issue, but also to decrease the rates of those who currently have pressure ulcers. The Affordable Care Act aims to target these gaps in performance in order to promote improvement and to promote reformation among nursing homes and other long-term care facilities. It is imperative that the government continues to utilize these indicators to track the quality of care delivered to its patients. Monitoring activities will be strengthened by federal participation. It is significant to monitor the progress to identify areas that need improvement or adjustment and to achieve new policies to promote better performance among nursing homes and long-term care facilities. As a proud caregiver, I am pleading with Congress for improved, more effective oversight of nursing homes and other long-term care facilities. Most patients are elderly with cognitive barriers that hinder them from making effective decisions or advocating for themselves. Bed sores develop quickly. Most sores heal with treatment, others never heal completely. In this incident, infections such as sepsis can develop. Implemented federally appointed teams that visit long-term care facilities specifically for bed sore monitoring is a possible solution. Demanding a higher quality of care today will ensure healthier generations to come. Thank you.